It's the January 2025 show with Dr. Amber McKnight from Simcoe Optometric Clinic. Amber, how are you?
I'm doing pretty good. How are you, Dave?
Good. Welcome to the new year. Real quick, I want you to give me, if you don't mind, to get 25 rolling an overview, because there always seems to be these concerns about what OHIP does and doesn't cover at the optometrist. Can you give me an overview of that?
Yep, that's a good topic to touch on. Just want everybody to know that you're always able to come in and have an appointment at the eye doctor's, whether it's just a routine kind of wellness check, or you're having changes with your vision or a problem with your eyes. Always give us a call. We're your primary eye care provider. We can always see you. It's just always a question of, are you going to pay for that with your insurance or out of pocket, or is OHIP going to pay for it? And the rules have changed recently, so it is a little tricky to keep track of. But first and foremost, anybody age 19 and younger is always covered by OHIP. Up to age 20, OHIP will cover routine visits, they'll cover emergency visits, any follow-ups that you need. If you've got, somebody young like that in your household, they're always eligible to come in and have OHIP coverage. There's some limits on when you can have what types of appointments, but that's for us to worry about, not for you to worry about. So call us anytime. If you're 19 and under, OHIP will always cover you. If you're 65 and over, OHIP will cover you for a full exam once a year or every 18 months, one of those two categories, and then cover a couple rechecks in between. So even if you're not due to come in and have your visit, oftentimes your appointment will be covered by OHIP. And we always try to strive for, if you won't be covered by OHIP, that we let you know before you book.
Oh, perfect. Yeah, and that way you can sort of make arrangements, right? Because you gotta have it, folks. You gotta have it done once a year for sure. You got to get in.
Yeah.
You mentioned off air, is January Glaucoma Awareness Month?
Yes, it is. Yeah. So the month of January, Glaucoma Awareness Month. So this is a topic that's really important to me and to a lot of my patients. So I think it's a great topic to have a month to bring awareness to. Glaucoma is an eye disease that, on average, I believe it's about 50% of people that have glaucoma don't even know that they have it, because it changes very slowly and gradually without a lot of symptoms in the beginning. So very key to come in and have your eyes tested regularly, like you said, Dave, every year, to check for early warning signs of glaucoma. Glaucoma is one of those conditions that you might not have any symptoms, but we can usually detect on our tests whether or not you have the early signs of glaucoma or it's something that you're at risk for. So really important for people to come in and be having regular eye exams, even if you're not having any changes or any symptoms that you're aware of. Still important to have checked.
If it's caught early enough, is it treatable?
Yes. Yep.
Okay.
Treatable. It's not completely fixable, but you can slow down the progression of the disease. And we always aim to do that and keep it, at bay so that you don't develop any symptoms.
Oh, I didn't know that. I knew it was treatable. I just didn't realize that slows that progression so that it doesn't overwhelm you. Because I guess when you get to the later stages of it, it's kind of irreversible, right?
Yes. Yeah. Any damage to your eyes from glaucoma is irreversible. Some forms are very, very difficult to control and difficult to slow down, and need to be treated with some more advanced measures. So that's why it is important. Early detection is the key 100% with glaucoma. It's really important.
So January is Glaucoma Awareness Month, folks. Be aware of that. Make sure you give Dr. Amber a call and get in and see her, and make sure you get that eye checkup done. I'm glad you cleared up that misconception on the OHIP a little bit, because it's one of those things you never know what changes, right? And I think we need to be updated constantly on it.
It's true. And the other thing, we mentioned people 19 and under and 65 and over. So us that are, 20 to 64, some of us are covered under OHIP as well. That's a little trickier. It's sort of case by case. The best would be to call your optometrist's office and double check. But definitely, if you've been diagnosed with diabetes, you're covered to come in annually for an eye exam. Again, sort of like glaucoma, this is something that can be detected and treated and managed long before you have any symptoms. Waiting until your vision starts to change from diabetes is too late. If you've been diagnosed with diabetes or you're taking medication for your blood sugar, you should be coming in once a year and having an eye check.
Can you give me a phone number if people want to come visit you?
Yeah, you can reach us at 519-426-3123, and you can find us online at simcoeoptometrist.com.
Hey, thanks for doing this today.
Yeah, thanks for having me.